this is ACE inhibitors are associated with an increased cancer risk. And the question is why? Okay, it's a small increase in cancer risk, but it continues to increase the longer the patient's on the drug. So these are angiotensin converting enzyme inhibitors. ACE inhibitors is what they call them. And the reason why this is interesting, you know, one of my internal medicine doctor buddies calls me and says, hey, Pete, lisinopril, an ACE inhibitor, is associated with increased risk of lung cancer. What do you think of that? And I said, well, I'll bet it's a mitochondrial inhibitor. So he goes, well, could you look it up? So I looked it up. Okay, so here's one paper, ACE inhibitors and risk of lung cancer, showing a small increased risk of lung cancer, getting worse as they're on them for more than 5 years. All right, then here's another paper. Angiotensin converting enzyme inhibitors and risk of lung cancer. Small long-term increase in lung cancer risk with ACE inhibitors compared with angiotensin receptor blockers. Observed increases in lung cancer risk are small. They're potentially important because of the common use of ACE inhibitors. Okay. All right, so let's see. Risk increased with longer use. So I went to my other book on atrial fibrillation. I put a long time into this book here. I think it's one of my better books, Prevent and Reverse AFib and CHF by Pete Rogers. And I made a long list of mitochondrial inhibitors, over 100 of them. And there you go, ACE inhibitors were included, captopril, lisinopril, for example. These are examples of ACE inhibitors, angiotensin converting enzyme inhibitors. Why is that interesting? It's actually very interesting because what was the mechanism of the Warburg effect for causing cancer? It was hypoxia-induced mitochondrial injury leading to the cell becoming anaerobic-like and developing cancer. So do you get it? There's over 100 mitochondrial inhibitors. Tons of people are on ACE inhibitors. Tons of people have tissue hypoxia due to hypertension, due to diabetes, due to atherosclerosis. Tons of them are eating non-organic food with mitochondrial inhibitors in there like atrazine, like glyphosate. They're drinking tap water with fluoride and aluminum mitochondrial inhibitors. They're taking other drugs that are mitochondrial inhibitors like statins, like Tylenol, like fluoroquinolone antibiotics. They've got heavy metal toxicity from cadmium, from other heavy metals, from lead. So anyways, I'm just showing it adds up. It makes sense. You get it? It's a common mechanism. Mitochondrial injury or inhibition seems to be a predisposing mechanism to causing increased risk of cancer from multiple sources. So the smart move would be go through this list. I got over 100 of them in this book right here. Prevent and Reverse AFib and CHF. I've also described them in a video. I've described them in this lecture. I got a whole bunch of, it's all free. Just go to my lectures where I go through all of them and see if you're on them. And you know, you might need to be on them. The benefit might outweigh the risk. But what I'm trying to help you to do is instead of sitting there like a helpless, dumb animal, you can go through the list and see, hey, I could stop this, I could stop this, I could stop this, I could stop this. I could thus increase oxygenation and ATP production in my cells and maybe decrease my likelihood of getting cancer and maybe improve my prognosis. I can't guarantee you anything, but I can tell you the logic is really good here.